The blank lab coat represents to me the white piece of paper, but obviously it's very symbolic of the uniform that the scientists wear. So I've created 3 stitch lab coats. The lab coats were given to me by the Institute of Cancer Research, and they belong to key scientists.
My specialist area of research is childhood brain tumours. In particular, my lab is focused on a type of cancer in kids which is currently incurable. For a bench scientist, I think putting on a lab coat really is the indication that it's time to get to work.
The lab coats feature testimonials from 10 cancer patients and their families from a wide age range, from children to adults. Some are still living with cancer, some sadly passed away from cancer.
I think being diagnosed with a cancer of unmet need, for example, a rare cancer, is actually a very daunting and lonely experience. Cancers of unmet need are cancers which are harder to treat. Their patients have poorer outcomes. They don't do as well as, for example, patients with more common cancer types.
The primary technique that I've used in this project is a technique called writing with a needle, where I copy the handwriting of an individual in needle and thread onto textile. Being entrusted with the words of the patients comes with a huge responsibility. Those words are like the voices of the patients themselves. So when you hand stitch those, it's like you're giving life to those words.
It's absolutely critical for us to remember why we do what we do. And we're very fortunate to have a lot of engagement with families who have unfortunately lost their children to these diseases, and it's extraordinarily motivational to us to hear their stories, to feel their support and their advocacy in everything that we do in the lab.
Knowing that the coats will be seen by the scientists is hugely inspiring to me, because it means that they will be hopefully encouraged and inspired to carry on the incredible work that they're already doing.
I think the future is very bright. I personally am very optimistic. There's a huge amount of momentum in the field to develop better ways to identify which patients to give existing drugs, but also identify new drugs for these patients of unmet need.
So I absolutely believe that we're going to see huge strides in the next few years. It's my vision really that we are able to offer a whole range of new clinical trials to parents and families and children who have these terrible tumours.
I hope that by hand stitching the words of these families, they will become part of the legacy, the great work that the Institute of Cancer Research is doing.